Good afternoon. Thank you for joining us here today for our Erie County COVID-19 update for July 15th. Pleased to be joined, of course, by our Health Commissioner, Dr. Gail Burstein, who you'll hear from in a few minutes, and Kendra Schmidt from Deaf Access Services, who's providing the American Sign Language. As always, we have information that is new, and we'll be presenting some of that, and the information is always rapidly changing. So what I say, or the doctor says, may actually have changed since we put this information in the screen and received it. That's just how things go in this situation here. As of July 13th, actually, I don't know if that's exactly right. I think it's actually as of July 14th, there were 7,743 positive cases. 652 people had died. As of July 13th, there were 47 individuals admitted to hospitals in Erie County, and 8 individuals were in the ICU, and 4 individuals had an airway assist. Talk a little bit more about that. Of course, the individuals who perished as a result of COVID-19 were individuals who all tested positive before their death. There are no presumed positives. Hospitalization data, this is Western New York as of the 13th, and you can see that little line in the bottom is going upwards again. There were 51 cases in Western New York as of the 13th, 10 of them in the ICU. A little interesting number, as we'll show, because in the next slide it shows how there's 47 cases in Erie County. For a few days there was a 1-case difference between Western New York and Erie County. Now you see a 4-case difference, which does tell me that there are some new cases in some of the other counties that make up Western New York. So there you go. There's our increase. We went from 43, I should say, on July 12th to 47 on July 13th, and we were as low, the lowest we've been, on July 1st at 31 cases. So we've seen a growth in the cases of COVID-19 positive patients in hospital. And we want to remind everybody, some of these patients may have been hospitalized for a non-COVID condition and then were tested in hospital and determined to be COVID-19 positive. If an individual is going for an elective surgery and they're all tested beforehand and they are determined to be positive, they're not going to be admitted to the hospital for their elective surgery until COVID-19 is out of their system. So it's not individuals who are going for elective surgery that are included. These are people who are hospitalized in a hospital basically for a day or more. So it's not somebody just going in for an elective surgery. These are individuals who are going there for a particular reason that could be related to COVID-19. It could be a serious illness, otherwise a heart attack, where they have to be hospitalized overnight, but they've determined to have COVID-19. So the numbers are trending upwards. We're not happy about that. And as I said from the slide before, there's 51 in Western New York, which is Erie County, Niagara County, Cattaraugus, Chautauqua, and Allegheny. There's 47 in Erie County, which means there was some growth in hospitals outside of Erie County. I don't know exactly where. I hope to find out a little bit later at 4 o'clock when I'm on the conference call with Western New York officials and the Lieutenant Governor to find out where that growth was. I do not know what county. COVID-19 cases by age and gender. We've seen this slide through many, many months now, but what we're seeing is the overtaking of the cases in the younger category. The age range that has the most COVID-19 positive cases is 20 to 29. There's no other age range that has more cases, positive cases, than that age group. And then the next appears to be the 30 to 39 age group. We know that while they were close before, usually the older age groups had the highest amount of cases. That does not, it's not the case anymore. It has changed. So what you have is the younger individuals making up a big proportion of overall cases. New cases, age groups. This is something we released online, but this is a little disconcerting that of the cases that were determined to be positive last week, 54% of them were between the ages of 20 and 39, with 52.3% of them being in the age group of 20 to 29. And as you look on the slide, the cumulative up to this point had been about 15.9% of the average of the caseloads. So what we're seeing, and that was always lower, of course, that's included the last couple of weeks where we've seen a big jump up in those age groups. So we are a little concerned about younger individuals testing positive for various reasons. I'll let the doctor go into a little bit more of that in a minute. But when 54% of your cases are in the age group of 20 to 40, basically, it should tell folks out there that just because you're young does not mean you're immune to COVID. You can catch it. You can get sick. You can die. The odds of you getting sick and dying are much less than somebody over the age of 60. However, you can catch it and you can transmit it to someone, a family member, a coworker. And that's what we're very concerned about, because that's what's happening down south, is that the age groups that were younger are the ones that were transmitting it amongst themselves and giving it to other individuals who are getting sick and having to be hospitalized. That's what I'm hearing from my colleagues down south. And we've seen the pictures of partying and all kinds of things down south. And unfortunately, we've seen pictures of that up here too, where people are having a grand old time. And what they're doing is they're having a grand old time also sharing COVID amongst themselves. Erie County hospitalizations. This is as of July 5th and July 13th. And you will see that there actually has been a decline in the number of individuals in the hospital in basically a week between the age of 45 to 64. It went down 2 cases. It also stayed the same in the 65 to 84 category, but it went up from the category of 20 to 44 by 7 cases. And it also went up in the 85 and above. So the greatest growth has actually been in hospitalizations of individuals between the ages of 20 and 44. It's still not large. We can easily handle it with the hospital capacity we have, but it is concerning that the greatest growth in hospitalizations in the last week are people who are young. And it should tell folks that just because you're young doesn't mean that you can't get sick. You can get sick from this, or it can affect something else that you're dealing with in your life. Cases by gender and residence, this has been pretty much the same for a while now. 56% of all cases are females, 44% males. And Buffalo cases are greater than the actual population should be for Buffalo. 45% of all cases are people who live in the city of Buffalo, and 55% or so of cases are those that live outside the city of Buffalo and the 2 other cities of Lackawanna, Tonawanda, and the 25 towns. Diagnostic testing, I'm going to turn it over to the doctor to talk about the testing and go into some of the other things here. And we can let you know what she's concerned about just as much as I am.
Thank you.
Let me put my mask back on.
Thanks. Good afternoon. So as our county executive said, we're seeing more testing in our community, and we're still seeing smaller numbers. A small proportion of all those tests are being positive. So this is a graph looking at the number of tests that have been done among Erie County residents, starting from the end of March, going all the way through the end of last week. And you can see that this month, every week, there have been anywhere between 17 to 20,000 tests being done among Erie County residents. And up until the end of last week, there have been, a very small proportion, just hovering like between 1.2 to 1.5% of those tests being positive. However, what we're seeing recently, just this week, and I don't think we have data on the, we do have data on this. Sorry, that's the antibody testing. Just going back, data that we're not showing in this slide is that this week we've had a much higher proportion of positive tests. So yesterday, there like 2.5% of all the tests were positive. So that's like, doubling of what we had seen last week. So we're in a very scary trend. We're seeing more people turn positive. We're seeing more people being admitted to the hospital. Again, as we showed data, many of those people that are positive are young in their 20s and 30s, and some of those are winding up in the hospital, even though the CDC reports that up to 40% of people with COVID-19 are asymptomatic or have minimal symptoms. And that's especially because we're probably seeing a lot of young people that are otherwise well and are less at risk of having other symptoms. However, some of those people do end up in the hospital, and they do end up pretty sick. And then also, many of those individuals have people in their lives that have other comorbid conditions or are elderly, and they can get sick. And unfortunately, we're seeing that. So we all have to be careful. We have to take care of ourselves, and we have to take care of the people around us. So this is looking at our COVID-19 antibody test from June through the end of last week. And so you can see that we've done over 25,000 people have been tested for antibodies in our community, and still a very small proportion of people have been exposed. So we're still thinking we're seeing all these people with COVID-19, that's all we're hearing in the news. Still among the Erie County population of almost 1 million people, only a little over 5% have tested positive. So, now, we know that people are getting antibodies, and we're hoping that there'll be some protective immunity. There are some recent data suggest that immunity might be more short-lived than we had hoped. However, we know that there are most of the people walking around in this county do not have antibodies. So we have to wait for a vaccine to become a vaccine preventable disease to make a change in that. However, many of us are still susceptible. So this is looking at our mortality data in Erie County through July 13th. And so, the trends are the same. Our elderly and more likely female compared to male are more likely to succumb to COVID-19. However, there are some people in the younger age group, so nobody is completely immune. So looking at mortality by residents, again, we are so proud that we're really one of the only areas in the country that can say that the proportion of people with COVID-19 who live in the city of Buffalo is very same as the proportion of people who actually, the total population that live in the city of Buffalo. So we're doing a good job with those type of disparities. Also, again, our fatalities are highest in our older age group. And then again, looking at health disparities, as I mentioned, we're really one of the only places in the country that just in terms of race, ethnicity, don't have disparities when it comes to COVID-19 fatality. So you can see that of people in Erie County who've been diagnosed with COVID-19, 80% have been white, and about 16% have been Black or African American. And then that's very similar to our entire population, where 80% of Erie County population is white and about 15% is African American. So we've done a really good job with addressing those health disparities in terms of mortality from COVID-19. So, getting a test. The county is still trying to be aggressive about getting people tested, both with a diagnostic test and with antibody tests if people are interested. So for both tests, you can call 716-858-2929 to schedule. Actually, for antibody testing, we now have online scheduling, so that is an option just for the antibody test. Remember, this is no cost. Erie County is paying for this. We want to make sure that people have access to testing. You don't need any type of lab requisition or physician's order. It is by appointment only. We've actually have been seeing a demand for diagnostic testing. So we've actually extended the hours of diagnostic testing at our sites. So because we want to make sure that we can test as many people possible as the laboratory allows us. We have and certainly a certain number of staff, but they are all working very, very hard right now, making sure that we can get those tests out in a timely timely fashion. You know, the Erie County Health Department are still getting out diagnostic tests within 48 hours. So if you talk to anybody else, they are waiting at least 7 days to get their test results. So our public health lab is rocking. So Megan, if you make an appointment, please keep it, because you know, we are really busy and people want to get tested, and you're going to be taking the spot of somebody else if you don't show up. And we have clinics throughout Erie County, which I'll show you. So of our diagnostic testing, you know, through this month, we have testing scheduled in Williamsville on Mondays, Orchard Park on Wednesdays, and then in the city of Buffalo, 14215, and Kensington High School on Thursdays. So we are trying to be all over the county. And the antibody testing we're doing on Tuesdays and Thursdays, and we're rotating all different sites throughout the county. So on Thursday, we'll be in Lancaster. On next week, Tuesday, we'll be in Aurora Senior Center, and then next week, Thursday, we'll be on Grand Island. So again, if people want to know where they can get a test, they can go to our interactive map at erie.gov/COVID test sites, and each of those purple stars corresponds to a testing site. You click on the star, they give you all the information that you need to know about what that site offers and what type of requirements they have. So just want to talk about Erie County Responds, and do you want to take this, or do you want me to take it? Okay, thanks. Give you a spritz.
Thank you, Doctor. I think we all know about the quarantine rules that exist in New York State. There are new states that were added, including Ohio. And we've had a number of calls to our call center in the county executive's office about, my kid's got a baseball tournament in Ohio. What happens? Well, if you go to the baseball tournament, you got to quarantine for 14 days after you return from Ohio. If you're going to Cleveland to go to the Rock and Roll Hall of Fame, you got to go and quarantine for 14 days. I spoke to County Executive Armin Budish of Cuyahoga County over the weekend, and he is very concerned about what he's seeing and what unfortunately does not appear to be happening in Ohio, which is strengthening of the rules. There was an increase in the Pittsburgh area, Allegheny County. Talked to County Executive Rich Fitzgerald down there over this weekend too. They closed all of their bars again. They closed all their indoor dining. So if you're planning on going to Pittsburgh, it's not on the list, but you're not going to be able to go to a bar, and the dining for indoors is now all shut down. And the increase in Ohio is such concerning that it was just put on the list of the quarantine states. So I think it's very important for the public to understand, especially those that are saying, hey, we're going to a baseball tournament. First off, you're not supposed to go to a baseball tournament, a soccer tournament, a lacrosse tournament under New York's rules. You can participate and play in the region. You can't leave the state to go elsewhere. If you go to one of the states that's in red, you got to quarantine for 14 days thereafter. There's a reason why. They have significant outbreaks of COVID-19, and they're not lessening. So we're telling people this is serious. This is how it's getting transmitted across state lines, is by people are going back and forth. We do know that some of the newest cases we've had are individuals who were traveling recently, including into some of these states. So the New York State Department of Health is screening passengers at the airport. That information is being provided to the Erie County Department of Health, and our staff then have to call those individuals to determine how they're doing in their quarantine period. So if you're flying into Buffalo, but it's not just Buffalo, if you're flying into Rochester, if you're flying into Syracuse, if you're flying into JFK, if you're flying into LaGuardia, from any of those states, you're going to see the New York State Department of Health individuals there requiring you to fill out basically a manifest form about where you were and where you're headed. If you've traveled overseas to Europe, it's very similar to the manifest form you have to do when you basically are entering customs. They give you a piece of paper, they say where you're from, where you're going, what were you doing, have you been exposed to certain illnesses. So that's exactly what's happening, and the New York State Department of Health collects that information. It is provided to Erie County Department of Health or Niagara County or wherever the person may live or is going to. And then we are required to contact those individuals and confirm whether they're quarantined or not. And that's what's being done by the Erie County Department of Health. So we want people to understand that this is a serious outbreak elsewhere. I think we all know what's going on across the country. We see it on national news. We see it on cable news. We see it on local news. We read it in the newspaper. There is a serious outbreak of COVID-19. It seems like every day they break another record for positive cases, and we do not want that here. We've done very well the last couple months. Unfortunately, the numbers are headed in the wrong direction. It's still low, but the wrong direction. But if people do not heed the guidelines and the requirements, and they are requirements, we could see our numbers go up. And you know what that means? I don't want to see our infection rates go up. If our infection rates go up above 5%, it doesn't matter if we're in phase 4 or not, schools will not open in the fall. And that's what's going to determine whether schools reopen in the fall is our infection rates. So if people want schools to reopen in the fall, and I know a lot of parents really do, I think a lot of teachers do, a lot of educators do, because they feel it's better for the students, we have to keep these infection rates down. And the best way to keep infection rates down is wear a mask when you're in public and do not go to these states unless it is urgent. And then if you do, you have to quarantine 14 days to ensure that you do not have COVID-19. COVID-related complaints, we get lots of them. And our Department of Health sanitarians are going out on COVID-related complaints to restaurants, bars, other food service. You can call and file a complaint anonymously at 961-6800. So it's 716-961-6800, or there's a link on our Erie County Department of Health website where you can fill out a form. If there are other types of businesses that you're complaining about that are not food service related or bars, then you should call the New York State PAWS number at 1-833-789-0470. There's also an online form for that, and you can also contact your local building inspector. So if you're seeing something that appears to be violating the law, but it's not food directly related, consumption of alcohol, so forth, then you should contact those numbers. And if you want, you can offer complaints about travelers returning from high-risk states. We have a link on our website. You see it on the screen at erie.gov/COVID-19/travel form. We have received information from the public about individuals who just returned from other states that are part of the quarantine who are going about their business and acting like nothing's wrong. So we have received a few of those, and those individuals have been contacted by our Erie County Department of Health. Enforcement of public health law. This is very important. We've had people say, you can't do this, it's not part of the law. It is. New York State, the New York State Code has been changed to include most recent executive orders as of July 9th, including face coverings. Business operators and building owners must deny entry and or remove any person who fails to comply with face covering requirements. It's New York State Code Section 10 NYCIR, subpart 66.3. And with regards to non-essential gatherings, all non-essential gatherings are still at 50 for phase 4. And the new code section prohibits any person from encouraging or promoting any non-essential gathering on public property. And there are violations and fines up to $1,000, including court orders. These are recently changed in Albany. It's now part of the New York State Code, the New York State law, and I think it's very important for the public to understand that our Department of Health has the power to enforce the law. It is the law. So we want people to understand they will enforce the law. We've worked with a number of restaurateurs and bar owners who've been cited to allow them the opportunity to reopen or to avoid closure, but we will shut down when necessary. As most people know, we shut down the Cowboy over the weekend on Chippewa Street. Last night, we actually shut down the Stage in Clarence for having more people than were required or allowed under the guidelines. The owner of the Stage was worked with our Department of Health today to allow us to reopen the location as long as they follow the guidance and the guidelines, and they agree they will not hold the events that they did in the past, and we'll be checking. When you're supposed to have 50 and you have 150 to 200 people in a closed area or a tight area, that's without masks. That's how you pass COVID-19 around. So We are out there. There are violations that are being issued. We have a policy where the first violation will not result in closure unless it is so egregious. So the general standard is you'll get a violation, you may get a fine, you will not be closed until the second violation. But we want bar owners and restaurateurs to understand this is the law. We don't want to shut you down. We'd prefer that you stay open so that people can go out to restaurants and bars. We get revenue from that too, so we'd much rather get the revenue with sales tax than not. But we will shut you down if we have to. And that's exactly what my counterpart in Allegheny County, Pennsylvania, Rich Fitzgerald, just did, is he made the decision that even though they were in their equivalent of phase 4, their numbers were going up so much and they were seeing increases from bars and restaurants, he shut down bars totally and they shut down all indoor dining. We do not want to do that here. We would do it if we had to. So what we're going to do is we're going to shut down locations that are violating the law so that the bad locations get shut down, but not everyone else. If the numbers go up to such a point where we had to shut down the whole system, we would do it. We don't want to do it. I don't want to do it. But if the numbers trend very high, like we're seeing in other places, like Cleveland or for that matter Pittsburgh, where they've had big increases, we'd have to take appropriate action. None of us want to take that action. So to bar owners, restaurateurs, food service operators, please follow the law. It's as simple as that. Please follow the law and you'll be fine, and we'll be better for it as a community. If you don't follow the law, you think, hey, I can get more people in there and make more money, you might find yourself shut down. And then we've got to inform the state liquor authority. And if it continues that we're passing coronavirus at such a rate that the infection rate goes up, it's going to make it tough for us to open up schools in the fall, and we do not want to go backwards out of phase 4 where we're shutting down bars and closing indoor dining again. But that's an alternative and an option if we had no choice. I'll turn it over to the doctor to talk about health fairs.
Thanks. So as the health department, we have our continuity of operations. We're still doing our health department health education thing. So on July 25th, we're going to be in Amherst. On August 8th, we're going to be in Tonawanda for a pop-up health fair. So we're going to be offering free Narcan and Narcan training and free Narcan boxes. We are going to be offering condoms, a lot of good sexual health information, good tobacco cessation information, information about cancer screening program, and our colorectal cancer screening kits where you can actually do your own colorectal screening in your own privacy of your own home, and mail in the specimen, which is a little piece of stool that you just collect from yourself in the toilet, and you can get a test, a screening test for cancer. And then also we are going to be handing out masks and hand sanitizers while supplies last. Those go pretty quickly, so if you're interested, why don't you come on out when we open up in usually at 9 o'clock. So I think we were able to entertain questions now.
When you look at the data and you look at the amount, are you taking questions?
I just wanted one final thing. If you're going to the health fair, it starts at 9. Please don't get there at 7:30. We had some people at the most recent health fair get there hour and a half beforehand, and as we were setting up the health fair, people were like, I need my things now. It's like, it doesn't start till 9, so health fair starts at 9. Don't get there at 7:30 expecting our staff to be there. And when they come around 8:30 to set up, please allow them to set up. You'll be first in line if you get there earlier. Get there at 9, everything will be fine.
When you look at the data, you talk about the people with, COVID-19 right now, more than half of them are in the age bracket of people that like to go to bars, like to go to restaurants. And then you see what's happening in other states, as you mentioned, Cleveland and Pittsburgh. I mean, obviously it's troubling, and you have taken measures to go out and cite these restaurants and things. But how can you really, with having restaurants and bars open, and we've only had them open for just a couple of weeks, how can you really know that that's not the reason why this is spreading?
The question is, how do we know how it's spreading? Well, we have contact tracers that talk to individuals. So when you, let's say you're 25 years old and you test positive for COVID-19, whether you got the test done from Erie County, New York State, another lab, a private entity, your doctor, the results come to Erie County. our contact tracers then are required to contact that individual. And we will say, okay, what were you doing? If the individual was, I was in my house for 14 days, except for the one day when I went to the grocery store, you probably caught it at the grocery store. But if you go, well, I was partying on the Chippewa Strip, I went to my buddy's house on July 4th, okay, which bar did you go to on the Chippewa Strip? And who was at the party? Because now we got to let them know that someone who was at the party is tested positive. And as we've seen elsewhere, we don't have it here yet, we don't have proof of it in Erie County. Some of these mass gatherings on July 4th are already starting to be seen as being super spreader events, where there were 30 people at a July 4th gathering and now 15 to 20 of them have tested positive. So it's the contact tracing that's the key. It's always been. That's why we focused, the governor focused on contact tracing, we focused on contact tracing. Get the contact tracers to communicate with the individuals. And that's why we need everybody who tests positive to tell us. A lot of people are like, I don't need to tell you. Well, you do, because you're putting at risk every other individual in a certain time period that you were in contact with. So the contact tracers provided information, and we found out from our contact tracers, at least in the last 2 weeks, that there has been increase of individuals going out and partying and travel. So those are the two biggest things. Can I specifically say there was one super spreader event in Erie County? And the answer is at this point, no. We're getting to that point right now, based on the date, where if people caught it on July 4th, they may start to see the actual effects of it. And it's not maybe totally surprising why we're seeing our numbers of positives go up, because people are now getting tested, they're not feeling so well, they're getting tested and they're, oh my God, I'm positive. Well, what did you do 11 days ago? When it can take as short as 2 days from contracting it to showing symptoms. So I'm not totally surprised to see the numbers are going up. We always knew it would go up as there's more and more individuals that are out and about, just even going to work. But what happened on July 4th it was always concerning to us, and now we're starting to see increase in cases in the positives, and it wouldn't shock me if people caught it while at a party at somebody's house, and or going to a bar where one of the reasons that we've shut down those two locations is they were over capacity and none of the people inside were wearing masks. Think about it this way. 5% of the individuals in Erie County are testing positive for antibodies. A little over 5%. So if you have 100 people in a location, the odds are pretty good that at least one of them is going to have COVID-19. And 5 of them may have had it or were exposed to it. So if you're in a tight enclosed area with a lot of people, your chance of getting sick is much higher than if you were with the same 100 people but outdoors and you were spread out. George, I think you had a question.
As far as enforcement, why hasn't any Erie County resident been fined $2,000 as a travel violator? 2 weeks ago, you said you had about 35 complaints that you were going to start investigating. I assume no one has actually been fined $2,000, and if not, why not?
I'm not aware of anybody who's been fined. The quarantine is voluntary under the governor's order. We're keeping track of the individuals we get information from. We cannot force them to stay. Now, if they are sick, we will then take it to a next level. But I'm not aware of anybody who's been fined as a result of the quarantine order.
So even the airport people yesterday, they're going to supply you the names and all these forms, and you got to call and make sure they're staying home, but you cannot find them.
They can be fined at the airport.
Right. But the follow-up, you can call them all you want, but you really cannot.
There's limitations on what we can do, George. We're following New York law. We're following the rules. There's just limitations on what we can do.
Mark, when you talk about,
Okay.
additional shutdowns coming back into the area, potentially if cases rise, is there a threshold that you're looking at, X amount of cases over time? And at the same time, is that something within your jurisdiction, or is this unilaterally on the governor?
We would be working with the governor's staff with regards to further shutdowns. Actually, I was texting back and forth with the governor yesterday and sharing some of the latest numbers with him, and he's concerned. He even said it, his office said it yesterday. They were concerned about the increases in upstate with regards to the 20 to 40-year-olds testing positive, as well as on Long Island. After everything we've done and went through, the last thing we want to do is go backwards. Are we surprised to see increases? No. But we cannot afford to have happen here what happened elsewhere. Remember, for the longest time, the Cleveland area and the Pittsburgh area had less cases than us. Cleveland area now has more cases. Pittsburgh is catching up. They opened up earlier with less restrictions. So now they're catching up. So we don't want to go backwards. The best way to not go backwards is wear a mask, avoid those settings where you can spread it. But yeah, we've had conversations with the state and none of us really want to think about having to shut down additional things. But we all agree that we'll do it if it was necessary. Is there a demarcation line? We don't have a demarcation line yet. It would depend on a lot of other things. Leanne?
Mark, you had mentioned that the stage in Clarence had been shut down for having too many people inside. Can you give us an idea about how many complaints the county has been receiving from people about bars or restaurants, and what sanitarians have specifically been seeing in the area? We start to see this rise. You guys are getting an increase in businesses that are not complying with the regulations. Are you thinking about putting in stiffer penalties for those businesses?
I'll turn it over. The question was with regards to how many complaints we're getting regarding bars and restaurants and what our sanitarians are doing. So, all yours.
Sure, thanks. So just to set the record straight, actually the stage, it wasn't just an indoor event, it was an outdoor event. They had probably around 150 people in the parking lot drinking beer, eating hot dogs. So, I mean, that was a violation. It was over 50 people. There were also a lot of people inside. The majority of the people at this event were outside. So it's not just limited to indoors, it can be outdoors too. So currently we're getting, environmental health is receiving about 25 complaints a day, all of which we do investigate. And then some of those, when we're not satisfied with the information we receive through our investigation of the phone, we go out to do a site visit with a public health sanitarian. Oftentimes, that sanitarian is accompanied by law enforcement, sheriff, in case we need to take greater action. Most of the time, especially when we're calling, we're learning that the restaurants and bars, I mean, they really want to do the right thing, and they are doing the right thing. And when we visit there, we confirm that many of them are complying with the regulations. However, as you know, we have found restaurants and bars that have been outside the regulations, and now with this new code that public health law that came into effect on July 9th. I mean, the health department has a greater power to issue violations and fines and actually closure orders. And now that we looking at the data, we're seeing that the age group at highest risk, the demographics, are people in their 20s and 40s. And then we go out to inspect the restaurants and bars, we're seeing the people out there are in their 20s and 40s. So we have to take action. I mean, public health is about making systems changes to help people do the right thing, to help people make a smart choice. And unfortunately, this is a system change that has had to be made, and we're just hoping that bars and restaurants comply to keep their employees healthy and safe and to keep their customers healthy and safe.
Sandra?
Yes.
Thanks.
The county legislature and the comptroller's office have recently made an issue of the amount of overtime that's being paid out of the CARES Act funding for managerial and confidential employees who don't normally get overtime. In some cases, we're talking tens of thousands of dollars. This has an impact on folks' pensions as well, long-term, particularly for folks who aren't in the high tiers. Just was interested in your response to that. I mean, it does seem like a lot of money.
I think the question was with regards to overtime that was paid to some employees, sheriffs, as well as managerial confidential. I'm actually surprised. I had a legislator said, I thought you guys were just working 9 to 5. And it was 13, 14-hour days. Individuals were working very hard and still have, really through the protest period, which is basically about a month ago. There were long hours and very long days, to the point where I've had to tell folks, you need to take a vacation. You're burning out. You need to get out of here. Even Dr. Burstein was gone for a few days to get away because it had been so much.
New York State.
Yes, she did stay in New York State with her family. There were a lot of hours that were spent, and there were a lot of, at least that I'm aware of, I can't vouch for every employee, like what was being done in other locations. I can vouch for who was here, and I saw the same people day in and day out for months, and to the point where I was telling people, you gotta take a day off. And usually when they're here, it was not 9 to 5. You get here at 8:30 in the morning, and you'd be here till 9, 10 o'clock at night. So they qualify for overtime under the rules. It is being paid for out of the CARES Act. So it's not like it's coming straight from the normal county dollars. It is something that is approved in the CARES Act. Overtime and salaries associated with the response to COVID-19 is approved payment, because it was understood that you're not just having somebody come in and working 8 hours, which under the county rules is basically 6.5, because you get an hour lunch and you get 2 15-minute breaks. So I'm a little surprised at some of the folks who are like, yeah, you guys worked hard. But I didn't realize you were working 12, 13 hours a day, and a lot of people were. I can't speak for every individual, and some of the department heads would have to, I'd say, yeah, here's the proof. When it comes to most of the county employees, they have to swipe in and swipe out. The only ones that don't are basically elected officials. For the record, I got no overtime, though I worked a lot of overtime. As an elected official, I get a salary. It's flat. I do not get overtime. I'm sure there's people out here thinking I padded my salary, and I can't, even if I wanted to. So, but other individuals worked very hard and a lot of hours. Every individual, I can't say exactly everything they were doing, but I do know from basically mid-March through early June, there were folks who were working a lot of hours, at least sometimes 6 days a week. And there was a point early on where people were working 2-3 weeks straight, and I'm like, you got to take a day off. You can't just work and work and work, because you're going to burn out. I don't know how many times I told the epidemiological staff that. I don't know how many times I told some of the commissioners and deputy commissioners that. You got to take a day off. And that's why we actually set up days off for like individuals. Okay, you're going to be off on this day. Dr. Burstein and I would always be off on days that were different from each other. Same thing with Dan Neverth and others. It was like, okay, there's key personnel that cannot be off on the same day. But we can't have everybody work 7 days in a row straight for 4 or 5 weeks in a row. And for a while there, it was nuts. I don't think people outside understood how much time and effort was being put in. And every day we were getting hit with multiple things that we hadn't even thought of. And there was a lot that went into it. We have a good team in Erie County. I think we've done a very good job with regards to the response. There's always things you learn that you could have maybe done better, and so you use that. Even today, we had a policy call of the leadership of the COVID-19 response today. And here we are in the middle of July, and it was nearly a 2-hour call as we were still going over issues that we have to deal with regards to COVID-19 response in our community. Overtime was accumulated. As I say, once again, I cannot vouch for every individual. I mean, I can only vouch for the ones that I saw here, and I know there were a lot of people here that were working lots of hours straight for basically months on end.
The county legislature was in particular looking at the sheriff's office. They had very high overtime numbers. I don't know if there's anything you have to say about that.
I have seen some of the numbers associated with employees. There's some that are high. Actually, the highest employee is Dr. Burstein, which is not surprising, because I remember, I mean, we were exchanging emails at 3 o'clock in the morning and 1:30 in the morning some days. I mean, like, you'd be surprised at, and it wasn't just us, it was others, and next thing you know, it was constant. The sheriff's office, there was a lot of effort that was also put in by the sheriff's office as part of our policy group, as part of the leadership team. There were individuals people don't realize this. We've talked about it, but we just recently closed the homeless shelter that was being used at ECC City campus. And there were at least 2 sheriff's deputies there throughout the whole period, because they had to help protect and ensure the safety and security of the facility. So there's a lot of things that went on behind the scenes with regards to COVID-19 response that a lot of people don't realize. Once again, I can't vouch for every employee. The sheriff's office should be able to talk about the individual employees. I do know of some of them that were here working very hard as part of our team, and I hope to never have to go through this again. That's why we don't want to go backwards, folks. It was no fun. It was bad. It was not a great time. For those of us who are responding, we will, if we have to respond again, we will, but none of us want to go through that again. It was physically and mentally draining, and I think we did as good a job as we possibly could. And if individuals abused overtime, well, then we need to deal with that. If they accumulated it because they worked hard on behalf of the people of Erie County, well, then they're entitled to it. Right.
You briefly mentioned school reopenings earlier. UB just announced more of their guidelines for reopening. Are you concerned at all about, a large university like that bringing in thousands and thousands of people into the area? And did the county be involved in that process at all?
The question with regards to reopening of schools, large universities like University of Buffalo, and is the county involved? And yeah, we are to a degree, and I'll turn it over to Dr. Burstein because I know she's very worried and wants to talk to them and has been talking in some ways with regards to the folks at UB about the safely reopening, so I'll turn it over to her.
Sure, thanks. Thank you. So just with the universities, they've received guidelines issued by the state a few weeks ago on how to safely reopen. At the health department, we just don't have the capacity to review everybody's plan, and however, we have let them know that they have specific questions. We're happy to help them, think it out, interpret some of the regulations as they were written. Where I think we are going to work the closest with higher education is through contact tracing. So case investigation and then identifying contacts. 'Cause I think the schools, those higher education, are really positioned the best to determine where the students were, who's in their classrooms, who do they live with in the dorm. I know that a lot of times the higher education are going to try to implement single person housing as much as possible, but they're really going to be our eyes and ears to finding out, identifying who these contacts are. And then also they're also on campus, so we're hoping that they'll also be able to step up and help with the monitoring of those individuals and see how we can work together. I think especially for the higher education, even for the school districts, I think the contact tracing, the identifying who the contacts are to all these cases will be how we can work together most closely with our higher education and our school districts.
Back to the test results. You mentioned Erie County is still getting them out within 48 hours, but some are taken up to 7 days. How much of
Longer than 7 days.
Yeah, so how much of a problem is that, or is that, like Quest, I hear, is taking really long? Give us some perspective on, is that just a minority of the 2,500 that are tested every day, or is that a problem when some of the testing is coming in slow?
Well, it is, so the question is, how much of a problem is it for public health when people don't receive their test results for 7 days or longer? So remember, this is a huge problem because the isolation period is for 10 days, after the person receives their test results or the onset of illness. And then quarantine is for 14 days after the last contact. So if an individual doesn't find out about their test results for 7 to 10 days, then it's they probably have not been in isolation for during that period while they're waiting for their results, and they don't really understand how to do it. They haven't been contacted by the health department and educated, and then by the time we determine who their close contacts are, probably the quarantine period will be over. So it's a problem with the commercial health labs. So as I said, our Erie County Health Department lab has a very fast turnaround time. I think the labs that are done locally, like in the hospitals, like Kaleida, Catholic Health, ECMC, Roswell, I think those have a faster turnaround time than the large commercial labs. Although I think all the hospitals that rely on commercial laboratory tests that they run in their lab are now challenged with shortages because the just to get the test reagents, and I mean that is presenting a problem. And so even the swabs or the pipettes to do the testing, I mean those are in short supply. And so I think everybody is just worried about the supplies, not only about just using the commercial labs, like Quest or LabCorp, the turnaround, but also being able to do locally here. We're fortunate in Erie County, we are using CDC's tests, and so CDC has not alerted to us to any concerns about shortages with their reagents. We're getting a smooth supply every 2 weeks. We put in an order and it is being filled. So, we're good with our supply for the test reagent, for the tests we have now from CDC. And, it's not competing with anybody else. It's, it's not any commercial product. But however, I mean, this is a threat to our ability to control. That's why it's so important for us to keep masking, social distancing, washing our hands. Thanks.
Yeah, if I can follow up, we are concerned, and part of the conversation we had in our policy group today was, can we expand testing? We have a limited amount of reagent, as the doctor noted. We've been getting it refilled regularly by the CDC labs that we get it from, so to speak, the agency, I should say. However, they're giving us a certain amount. It's not like if we asked for, we would like 20,000 more reagents, they'd give us 20,000 more reagents. They'd look at what are you capable of doing in a 2-week period. You'll get that. So we feel comfortable, but what we're also trying to do is, can we ramp that up? Because we do not want to get in a situation where the private labs cannot keep up with the need. And they're kind of getting to that point right now because of what's happening across the country. So if we can ramp up and do more tests, and as the doctor knows, there's limitations on what we can do internally with regards to the amount of equipment and staff we have, but if we can, we would like to do it. And if you are thinking about getting a test, the fastest results come from the Erie County Public Health Lab. Call 858-2929 to schedule your appointment. You may not get the appointment date you want because maybe a particular date's full, but if you get it, you could theoretically have your results in 48 hours. Sandra, I'll come to you, Michael.
Along those similar lines, do you have any concerns about the ability for the county to keep up with personal protective equipment that you guys have been on a relentless search for over these past few months? I know things have gotten a little bit better, but now with there being more competition in other parts of the country for N95 masks and other things, what are your concerns going forward if there were to be another surge here about the county's preparedness?
The question was, what is our concern about personal protective equipment? I think you guys were listening into our policy call earlier because we were talking about testing and ramping up our testing, and we were talking about PPE, which actually we weren't talking about because we require every week that we have a list of PPE. We feel comfortable about where we are right now. There are some supplies that we have that are more than 90 days. There are some supplies that we have that are 60 to 45 to 60 days. We're comfortable about where we are right now. The problem is you can't buy some of this stuff for hoping you use it a year and a half from now. There's limitations, and some of them can age out. But we are in a much better position than I gather most of my county colleagues are down south, where they're already scrambling and they're saying you need to rewash your N95 masks. Well, we have N95 masks that'll last a particular period. I believe, I shouldn't say I believe, I know we have over 2 million procedural masks in our stockpile. We're stockpiling gowns, procedural masks, N95s, which of course are gold. Actually, they're platinum, but we have N95s for a particular period. Gloves, face shields, goggles. We feel comfortable about face shields and goggles. Those are actually fairly easy to get a hold of now. It's the N95s. And gowns, there's other parts of the country that are having significant difficulty getting gowns. We have a sufficient supply of gowns. But our stockpile is never as high as you'd like. But compared to where we were about 2 months ago and where other parts of the country are, I think we're in a pretty good spot. And that is not something that we're just like, worried about. Think about it later. No. That is one of the priorities of the policy team and our acquisition team, our logistics team, our purchasing team, It really, the involvement in acquiring PPE involves the Department of Purchasing, Valerie Ferraccio, our purchasing director, who you've not seen during this, but she's been here, as well as her team. The Department of Public Works, Bill Gary and his team. The Department of Homeland Security and Emergency Services, Dan Neverth and Greg Butcher and their teams, including basically having the equivalent of Fort Knox at our warehouse with regards to the distribution of PPE, because when it comes in, it comes to our warehouse, and then there's really a very tight mechanism to ensure that it's going out to the right sources and it's not going out incorrectly. The Sheriff's Office has been involved as well with regards to the acquisition of PPE. So it's a lot of these things behind the scenes that people don't really pay attention to. But when you're talking about millions of procedural grounds, millions of procedural masks, hundreds of thousands of gloves and gowns and things like that, it's a huge operation. And the one thing I do not want to be is stuck in the fall saying, oh man, I wish in July and August I had procured more PPE. So we are not going to allow that to happen. I know that there's big problems elsewhere, and that's because when we were going through our worst period, they were sitting there thinking, oh, we're okay. We don't have to worry. And now they have huge problems. So we know what the worst case scenario is, and I directed the commissioners, the directors, to address this as best as we can by acquiring as much PPE that we can logically use within a certain time period so we have it on hand if we need it. And it is one of those things that I don't ever want to have to get a call saying, Mark, we did our best, we no longer have masks. So we're doing what we can to acquire it now for future use, because we are anticipating that there's going to be a spike in the fall. We're just hoping we don't have a spike in the rest of the summer because of activities of people not following the rules. Michael?
I don't suppose the bills were brought up during that conference call, were they?
Actually, the bills were not brought up during the conference
So
call.
this is a unique question for today, then. We're seeing some teams announce certain policies. Patriots, for example, limit capacity in the stadium. Same with Baltimore. Philadelphia, they did a city policy that said, no large events through, sometime in the fall. Has there been any thought given to doing something similar in Erie County, and have you heard anything from the Buffalo Bills about what they're planning to do for stadium capacity this fall?
The question, of course, regarding the bills, have we heard from the bills regarding stadium capacity? What are the plans for large events? And I have spoken to the bills. We are actually having regular phone meetings now as we get closer to the season. Right now, there are, of course, no fans that would be allowed in professional sports. That could change, but New York State is not allowing any fans to attend games for professional sports teams. I believe the first preseason game at home is in late August. It's like the third preseason game. There's still questions as to whether they're going to have 2 preseason games or 4 preseason games. We do know the training camp will be held in Orchard Park. There's other information that's been shared that I'm not at liberty to disclose right now that I am aware of with regards to NFL policies that have not officially been released yet, but will be coming out soon with regards to what would the expectations would be for how many fans can attend a game, what would the expectations be with regards to activities in the stadium, would you have to wear a mask throughout the whole stadium, things like that. That stuff will be coming soon. We are aware of it. We've had good conversations with the Bills. The Bills have always been a very good partner with us. We don't always agree on everything, but we do have a very good working relationship with the Bills organization. And they are concerned about their fans as well. They would like as many fans as possible to attend the games, but they also understand that there's a health risk. So they're going to do what they have to ensure the safety of their patrons, if we are even allowed to have patrons. And I can say that we have had a conversation as part of our conversations with what can we do in regards to if there's like a mass gathering. Let's say there's no patrons allowed in the stadium, no fans. But someone decides, hey, come over to our place and we're going to have 400 people. We're going to have the biggest keg party, watch the Bills on multiple screen televisions. Well, then New York State's health law applies. You can't have gatherings over 50 people. You can't advertise that you're going to have gatherings that bring in large amounts. So we'd be in a position where we'd have to enforce the law. And I'm not afraid to do that. And I've given full power to the Department of Health and its Environmental Health Division to enforce the law. We've had a few restaurateurs want to reach out and talk to me about, well, why are you doing this? And the answer is, If the sanitarians go out there with a sheriff's office deputy and they determine that you've violated the law, they're gonna issue the citation. I'm not gonna stop it just because it's a well-known bar or something like that. Our number one priority is protecting the public's health. And my goal is to protect the public's health as much as we can so that we have football games in the fall, so Josh Allen is passing the ball, and if this is the year we win the Super Bowl, I don't care, as long as we win the Super Bowl. If there's no fans there, at least we can celebrate and say we saw the Super Bowl. And the only way that's gonna happen is if the football season is allowed to happen. And the only way the football season is gonna be allowed to happen is if we keep our rates low. Truthfully, what I'm very worried about right now are the numbers in other states. How is the NFL going to protect in some of these other states where you're seeing these skyrocketing numbers? Houston Texans. I mean, how are they going to protect it when Houston is in like Phoenix? Maricopa County has some of the highest rates. How are you going to protect Phoenix? And if you're a team flying in from outside that area, I mean, how are they going to do that? That's what I'm very worried about. And I think the Bills are just as much worried about it. People feel pretty good about Buffalo and how we can protect our citizens here. I think they're just as worried as anyone else about what's going on in the rest of the country.
These gatherings would apply to tailgates too?
Tailgates, yes. If there's no fans allowed in the stadium, there will be no tailgating at the stadium.
What about private lots?
Private lots, there would be, they have to get an approval and a permit from the town of Orchard Park. And right now, it's my understanding Orchard Park is not issuing permits for private lots.
This is my last question of the day. Any blowback from Bill's officials about your comments last week about a new era?
We've had conversations with regards to all kinds of things. I think they know it, and they understand where I am with regards to the stadium and the name. And I wouldn't say there was any blowback, no. They understand my role in the community is different than theirs. As the leader of a community that seen individuals lose their job, it's always disappointing. I hate to see it. It's like most recently I commented with regards to Western New York off-track betting. They just took $3 million PPP loan. They also recently gave salary increases, raises to some of their highest paid employees, and now they just laid off 300 individuals. Well, that's actually a publicly owned facility. Erie County is one of 16 others, I think, 17 total counties and organizations like the City of Buffalo that are part of it. The leadership of Western New York Regional Off-Track Betting has got to come in to the legislature, talk about why they did that, why they laid off folks, have they given raises, who got the PPP money. It's the same issues I had with New Era. If somebody takes that money and then immediately lays off a whole bunch of people, that's a questionable action to me. And so for the football stadium, we've had good conversations about that. And yes, I'll be referring it to as the football stadium in Orchard Park. Sandra, do you have one more question? Yes, I thought you had one.
Actually, I'm curious to know about the hospitalization numbers. Is there any way to break down, given the rise that we're seeing, how these folks may have contracted it? I mean, I don't know if there are contact tracers who are actually looking at just the hospital population.
Well, they do, but there's a limitation sometimes when you can talk to these people depending upon their illness. I'll let the doctor talk about it more. But yeah, we actually, that's something that we have talked about, and we've been trying to get more information. The individuals who are hospitalized, why are they there, and what did they do that they may have contracted it?
Right.
It's not always easy because like for example, if a person's in the ICU, thankfully there's hardly anybody on an airway assist, but there's 4 people. And for those people, you're not talking to them because they're basically in a medically induced coma. The others in the ICU, you might not have an opportunity to talk to them for a while. Some of them, yeah, you might be able to talk to them usually after they're released from the hospital. But yeah, that is information that we are very much interested in, which is how are these people who are testing positive and being hospitalized, how are they catching it, and where were they? Now, the odds of someone catching it, we know it's in the community, so the odds are actually quite high. You could catch it if you're going out without a mask into a large gathering. The odds are fairly, I don't want to say the low, the remote, but yeah, you could catch it. But how and where, we need to know that. But for some of these folks, we can't talk to them right away just because of being hospitalized themselves.
But you aren't trying to gather that?
We are trying to gather. Yes, the contact tracers are trying to gather that. I don't know to what extent is the percentage of all hospitalized we'll be able to gather, so it's a good number. If, like I say, there's, let me make sure I read that right, yeah, 47 people hospitalized in Erie County hospitals with COVID-19 on July 13th. If we were able to communicate with, let's say, 38 of those individuals, that would probably be a pretty good percentage of, yeah, we know where most of them caught it. If we're only able to communicate with 10, it's not as good a percentage of the overall amount that's hospitalized to have an idea, but it's better than 0. And in some of these individuals, this is the thing, our contact tracers may have already talked to them when they tested positive. And then they become hospitalized later. So we're trying to get that information. The problem is we don't get the names of the individuals who are hospitalized. We get the names of the people who test positive, and then we get the names of the people who die. But we don't get the names of the people who are hospitalized, so we also have to rely on information from the hospitals. I've actually requested from all the hospitals, and they're in the process of compiling, and I'm actually hoping to have it by the end of the day, the number of people who were hospitalized. We know how many people have tested positive. We know how many people have died. We know how many people were in hospitals on any one day, but we don't have an exact sort of number on how many people were actually hospitalized. So every one of the hospital units is pledged to go through their records and determine, yes, they had, let's say, 700 patients that went through this one hospital system. Some of those patients may have been there for one night, others may have been there for 3 months, but they're still just one individual. So we're trying to get that information to find out of the individuals who tested positive that were confirmed cases, doesn't include the ones that were non-confirmed, how many of them and what percentage of them were hospitalized. We're trying to get that information, and I think, and this is the nice thing, we've had a little bit of slowdown, so now we're not doing the, oh my Lord, the house is on fire, we've got to react to that. Now we can start doing some of this other data mining and things that we wanted to do, but they couldn't do just because we didn't have the time to do it. So now we can work with our hospital systems to get that information. And actually I was on the phone with one of the hospital leaders yesterday about this, and I feel confident with the next couple of days we're actually going to have a pretty good number to say of the 7,000 plus that have tested positive in Erie County, these are the number of people who actually were hospitalized, at least for one night. Any other questions? If not, everyone be safe and well. There is a chance of some serious weather coming into our region tomorrow with even I saw a remote, though not 100% no opportunity, I should say. I mean, that's not the best use of the English language. There's a slight possibility of even a tornado tomorrow, as was stated by the Weather Service in the report from earlier today. So be careful tomorrow. Our Department of Homeland Security, Emergency Services, and Public Works will be ready if we get severe storms and they're blowing down trees and things like that. We'll be working with power companies on power restoration, as we often are. But I just recommend to people out there, please be safe and be careful tomorrow. Exceptional, they're expecting heavy rainfall, strong thunderstorms, heavy winds, and as we noted, even a possibility of a tornado. So we'll be on the watch tomorrow. Please be safe, be well, everyone. And when you go out in public, wear your mask. Could save your life. Thanks. Thank you, Kendra.
Your